Hello friends, today we are going to discuss role of CT angiography and invasive angiography in the diagnosis of coronary artery disease. Now coming to CT angiography first. CT coronary angiography is a non-invasive test. It uses a CT scanner and a contrast dye. Now coming to its key feature. We can visualize a coronary artery in 3D. We can detect both stenosis as well as plaque morphology, that is calcified or non-calcified. It is useful in low or intermediate risk patient and it is a quick outpatient procedure. Now coming to its advantages. First, it is a non-invasive test. Second, it has excellent negative predictive value. That means if CT coronary angiography is negative, that makes coronary artery disease highly unlikely. It assesses both plaque burden and coronary anatomy comprehensively. Now coming to its limitation. First, it may overestimate stenosis due to calcium artifact. It has limited role in patient with increased heart rate or arrhythmias, and we cannot perform therapeutic intervention. Now coming to invasive coronary angiography. Invasive coronary angiography is a catheter based gold standard test. We can visualize the lumen of the coronary artery via fluoroscopy. We can measure the extent of stenosis accurately. Depending on the extent of stenosis, it can be classified into minimal stenosis, that is if it is less than 25%, mild stenosis if stenosis is between 25 to 50%, moderate stenosis if stenosis is between 50 to 70%, severe stenosis if it is between 70 to 99%, and then complete coronary artery occlusion, that is 100%. It also allows simultaneous angioplasty and stenting. If stenosis is more than 70%, then percutaneous intervention in the form of PTCA with stenting is often required. Now, in ambiguous lesion, FFR can be used. FFR is a physiological index used during coronary angiography to determine functional assessment of a coronary artery stenosis. Lesions can be classified into hemodynamically significant lesion or hemodynamically insignificant lesion. FFR guides revascularization decision and intermediate lesions. If FFR is less than 0.80, it means lesion is hemodynamically significant and stenting is required. If FFR is more than 0.80, then it means lesion is hemodynamically insignificant and stenting is not required. Now coming to its advantages. It is a gold standard test for the diagnosis of CAD. It provides high temporal and spatial resolution. It provides real-time assessment and treatment. Now we will go through limitation. First, it is an invasive test. It requires arterial puncture. Second, there is risk of complication in the form of bleeding or vessel injury. Thus, in a patient in which CAD is unlikely, for example, low or intermediate risk category patient, non-invasive test in the form of CT coronary angiography can be the choice. Whereas in patients when there is a strong possibility of coronary artery disease, then invasive coronary angiography is the investigation of choice. Thank you.